Alright, I still have my father, Dr. Douglas Puryear, here to answer a few questions about the video y'all just saw. What is your immediate reaction to this?
Well, I thought it was a great summary of the impact of Obamacare, otherwise known as the Affordable Health Care Act. Um, I've only seen a few weeks' effect on my patients as I practice pulmonary critical care and sleep medicine. And so the full impact, I don't think we know, but I've had over the last 6 months, a number of patients made me aware that their insurance premiums were going up. Some of those individuals made me aware that they would not be able to afford those premiums and would not be able to come back to see me as patients. Others have been given high deductible plans which will impair their access to care because of the increased cost, and they don't have the liquidity in their finances to be able to pay $1,500, $3,000, $6,000, $6,500, or whatever the deductible might be. Also, the way this is affecting small businesses, employers, if they have a certain number of employees, they have mandatory payments that they'll have to pay to the government. Also, if they have full-time employees, that will increase their expenses. So many businesses are taking the angle of part-time hours, part-time positions to try to minimize their costs. And I think that observation is brought out by the speaker on the video, with young people not being able to get jobs because of the extra expenses on small business.
As Senator Cruz said, do you really think this could destroy our economy?
Well, I think it has a major impact, and based on what I've read and experienced, that if we were able to make this Obamacare go away, I think business would be willing to spend and invest in growth in the economy. No one really knows how this is really going to affect us long term, so I think people have been very, very conservative and very cautious as they're planning their 5-year plans with their businesses, because the full impact, I don't think, is truly understood. And so we'll have to go through a year or two under this plan before, as a small business person, as well as a physician, how this is going to impact my practice.
Alright, so some people have the view that this can infringe upon First Amendment right of freedom of expression. Do you support that?
Can I explain that further? What do you mean by that?
Many things can be under First Amendment, like freedom of speech, freedom of religion, and freedom of expression, which is how you use your finances, you express yourself, things like that.
Gotcha. I think this is an infraction of that, because you're being told by the federal government that you have to have health insurance, and the original legislation actually made specific requirements of that insurance, and that's one of the things that drove up the cost, because many of the policies that were out there that were very good for individuals did not have all of the required aspects of the policies that the Affordable Health Care Act said it must have. And because of that, that led to cancellation of policies, and many people were adversely affected by that.
This is a big one. Do you think this is borderline socialism?
I don't think it's borderline socialism. I think it's 100% socialism, because it's nothing borderline about it. This is the government taking resources and redistributing them. Free market, and it's being completely taken out of that, and they're taking the resources that individuals have and spreading it out among the people that do not have resources, and it's just another example of big government interfering with what should be a matter of a family and an individual to choose their health care, their cost, and what coverage that they require to meet the needs of those individuals.
Thank you for your time.
Thank you.